Good evening, everyone. Thank you for joining us tonight for our part 2 of our Goat Essentials webinar series. Welcome back to those returning from last week, and welcome to all those who are seeing us for the first time. My name's Tegan. I'm the project manager of StockSense. This is a project run by the Victorian Farmers Federation, and it's funded by both the cattle and the sheep and goat compensation funds. So our main role is to help educate Victorian livestock producers and hobby farmers about their responsibilities around particularly biosecurity, but also animal health and welfare. So we do a number of educational workshops across Victoria throughout the year. We also run these webinars, and we have a number of resources on our website, as well as a newsletter which is sent out quarterly, which you can also sign up on through our website. We've got a couple of other upcoming events if you're interested. On 28th of February for those goat enthusiasts, if you're in the Winton area, we've got a goat foot pairing workshop, which will be a practical and a really good one to improve your skills. All these events are free, so you just have to register and come along. We've also got a fencing workshop near Carramburra in Victoria in March, and also if you've got calves or you know someone who've got cattle, we've got a webinar coming up in March for that as well. So this is our email address, stocksense@vff.org.au, if you've got any questions or queries. Our website is there. You can find all our events on the website, as well as our other resources, as I mentioned. We've also got social media, Instagram and Facebook. Give us a follow and you'll be able to keep updated on events coming up. So before I get started, your feedback is very important to us. As a government-funded program, we rely on feedback to help us continue this project. So we will be sending out a survey at the end of this webinar. So please just fill it out. It should only take a couple of minutes. That'd be great. Thank you. So tonight we have Dr. Sandra Baxendell to speak to us about pregnancy, toxemia, kidding and care of newborns. So we're really lucky to have Sandra. She's got extensive formal qualifications. She writes extensively about goats, worked on a number of commercial goat farms with a range of breeds. So really looking forward to hearing from Sandra. Just a couple of things. If you've got a question, please type it in the Q&A box throughout the webinar, and we'll get to those at the end. So this will be about an hour presentation with 20 to 30 minutes at the end for questions. So please, just type them in whenever you think of them. And also the slides and the link to the recording will be emailed to you in the next couple of days. So keep an eye out for that one. And with that, I will pass over to you, Sandra. Thank you.
Okay, so welcome everyone. And I'll just share my PowerPoint and go to full screen. Sit easy. So everyone wants their doe kid to kid naturally, no trouble, and end up with some nice, healthy kids at the end of it. So invested 150 days, slightly less if it's a miniature breed, and you're hoping for some nice live kids at the end. So let's see about how we can help you achieve that. But firstly, I want to talk about Q fever. I was just mentioning today that there's a media coverage of an uptick in Q fever cases in Victoria. Now, all vet students now, and a lot of ag students too, get vaccinated for Q fever. when they're students. And you should consider that because the birth fluids of goats, sheep, cattle have often got very, very high levels of the Q fever organism, and therefore you're exposed. And you don't want to get Q fever. It's flu-like symptoms, but also can give you a chronic fatigue syndrome, and no one wants that. So talk to your GP about getting a skin and blood test and then getting the vaccine if you've not been exposed. Also, you need to vaccinate your heavily pregnant does. So 1 month before their expected kidding date, they should get a booster vaccination. In most areas, that's going to be Glandvac 3. If you're in a black leg area, then it'll have to be Glandvac 6. But your veterinarian will be able to advise you on that. It should be 1 month before, and that gives enough time to make sure that the colostrum is full of antibodies that are going to protect that newborn kid after she has the first suckle from the mother or the first bottle of colostrum. And that's very important for tetanus. So this is what tetanus does to a kid. This poor thing, you can see it's a kid, the umbilicus is still present. It can get through the umbilical cord and go straight into the bloodstream. So this is not due to banding or anything like that. This is straight through the navel cord and contamination. You'll see how it's stiff and how it's having convulsions. Now, pregnant does must not be too fat and they must not be too thin. So we need to look at the pregnant doe. If it's got this amount of fat underneath the tail, then that's a condition score 5, and that's obese. Similarly, if it's got rolls of fat behind the front leg or in this brisket area, it's an obese goat. And these will be very susceptible to pregnancy toxemia, and they'll have to be carefully monitored. Similarly, if you've got this goat here, it actually has caprine arthritis and cephalitis, and you can literally feel every bone on its backbone and in its ribs. So that's a condition score 1. Now, goats in poor condition, if they're rangelands, they tend to abort. But other breeds tend to get pregnancy toxemia. So some of the miniatures that are derived from rangeland goats might abort if they're in very poor condition, and especially if they're then stressed. But the other breeds are going to be susceptible to pregnancy toxemia. So this is your body condition score. It's going to change. It'll be lowest straight after weaning because they put all their energy and diet into raising their kids. They should be on a rising plane of nutrition before breeding, so that's now. And in early gestation, they should be that condition score 3.5, late gestation no more than 3.5, and early kidding, early lactation, they're obviously going to drop some weight and put their condition into producing milk. Now, there's nothing you can do when the goat is pregnant. You can't put it on a diet. You need to plan ahead before mating if that goat needs to lose body condition. And stress is often a trigger for abortions if it's a rangeland goat or for pregnancy toxemia. Now, goat's sole source of progesterone, which is the pregnancy hormone that maintains the pregnancy, is the corpus luteum. In sheep and cattle, there's progesterone produced by the placenta, but in goats, its sole source of progesterone is the corpus luteum, and this can be destroyed by cortisol, which is the stress hormone. So don't transport them, don't do any surgery that's unnecessary for them, handle them gently so there's no stress, because that can trigger pregnancy toxemia. Again, if these does are very fat they're going to be very, very susceptible. And you can see some 3 very pregnant, very fat Saanen goats. Now, why is that the case? Now, goats produce a lot of fat and they store it in the abdomen, whereas a sheep or a cow can store it underneath their skin, along their back line in the case of beef cattle. But in goats, most of it is internal, around near the kidneys. So if you've got a pregnant goat with a uterus full of kids, you've got an enormous amount of fat in the abdomen, there's very little room left for the rumen, which means its feed intake is going to be restricted because the rumen can't take very much in because of just a lack of abdominal capacity. So goats store their fat internally. So you can see here, that's the kidney, and you can see all the fat around it. And again, more fat here, just near the diaphragm there. Now, this is a photo from a sheep, and you can see that with those big lambs in there, there's very little room left for the rumen. And that makes the doe very susceptible because they just can't eat enough to get the energy they need. So this is from Meat and Livestock Australia report on goat nutrition, and it's looking at boar goats. So a 60-kilogram boar goat in late pregnancy requires 13.43 megajoules of metabolizable energy and 178 grams of crude protein. And what happens is that in Victoria, when you've got nice, lush clover and perennial ryegrass pastures, just after the season break, that dry matter content of that pasture is only 14%. So it's mostly water. It's like eating lettuce. The crude protein is nice and high, but again, it's just so high in water. So in order to eat 1.27 kilograms of dry matter, which is what she needs, she's going to have to eat 9 kilograms of wet pasture. And there's just not enough space in the abdomen to do that. So commercial sheep producers will ultrasound pregnant females and they'll put them into groups so that they can feed those that are producing twins or triplets. They can start feeding them some grain or some high protein feed. And some commercial meat goat producers are now doing that as well. So you have to be able to distinguish between pregnancy toxemia and milk fever. So a doe with pregnancy toxemia, that's this one here, she's not eating, but she's down, but she's reasonably alert. So let's have a look at milk fever. So you can see this goat's muscles are not working properly. She's already kidded and she's producing a lot of milk. Respiratory rate is very high, but it's mainly that the muscles are twitching and they're not working properly. So this is how you tell the difference. Pregnancy toxemia is very common. Milk fever or hypocalcemia is rare. You can use your phone, just the torch on your phone, and put it on the pupils. And in pregnancy toxemia, they react normally to light. And in hypocalcemia, because calcium is necessary for muscles, that pupil is slow to contract. In pregnancy toxemia, there's swelling of the feet, but in hypocalcemia, there's tremors and twitching, as we saw. Pregnancy toxemia, normal respiratory rate, hypocalcemia, very fast. Pregnancy toxemia, very slow to minimal response to treatment, but hypocalcemia, rapid response. After a stressful event, and that could be dogs getting in, could be transportation, could be rough handling, 1 to 2 days is needed to trigger pregnancy toxemia, but a lot less, half to 1 day for hypocalcemia. and hypocalcemia is going to kill them rapidly within that day. But I'll just point out down below there that 20% of does with pregnancy toxemia will have some subclinical hypocalcemia. And that means that their uterus muscles are not going to contract properly, and that's going to make a difficult delivery because the uterus is not going to respond well to the hormones. So the clinical signs you're looking for, you're looking for that swollen legs. They're initially very vague, so they'll isolate themselves from the herd. They won't have much of an appetite, swollen lower limbs. They may teeth grind. They'll appear weak. In sheep, they have nervous signs, but rare in goats. Then the kids will die in the uterus. Then they release toxins, and then the doe will die. So there's a high mortality rate of both the doe and the kids. It's easily confirmed by testing the urine for ketones. Now, you just go into a normal chemist and ask for some keto diastics. They use them for people that want to go on these high-protein diets, and also for people that are diabetic. So they're easy to come by, and you just dip the sticks in to the doe's urine and see if there's ketones present. There shouldn't be any ketones present. And you can tell the amount, and that will help you monitor them. So how do you treat it? Well, first of all, you've got to decide, is it primary or is it secondary? If the goat has any other disease that's affecting its appetite, then you've got to treat that disease as well, because if there's a reduction in appetite, then the doe is going to get pregnancy toxemia. If they're still eating, you can increase the quality and the energy density of their feed. Vitamin Bs are useful as they can stimulate appetite, but none are registered for goats, so you'll have to get a vet's prescription. You can use electrolyte products with glucose. Propylene glycol is recommended, and I'll show you some brand names, because if you walk in and say you want some propylene glycol, most people will just look at you blankly. If you walk into Elders or Wesfarmers, they won't know what you're talking about. The dose is 100 to 200 mils 2 to 3 times a day, or half that for miniatures. Or you can use glycerin that you get from the chemist or supermarket, and the dose is 60 to 80 mils twice a day. But most importantly, you should use non-steroidal anti-inflammatory drugs from your veterinarian. So these are some commercial treatments that you can use for treating pregnancy toxemia. They have the same ingredients as ceton. It only comes in 5 litres, but there's also ketol, which comes in 2 litres, which might be more useful for a hobby farmer. So your veterinarian can get those for you. And sometimes they're sold by farm suppliers. Non-steroidal anti-inflammatory drugs, I highly recommend them. They have been shown in sheep to increase the survival rate of the ewes from 22 to 88%. So that's a massive increase. It's off-label, so you will need a vet's prescription. Intravenous is ideal. Again, vet can do that, or you can use it into subcutaneously under the skin. So strongly advised, you can use other non-steroidal anti-inflammatory drugs. The most important thing is to induce kidding. You have to decide what's more important, the doe or the kids. If you can nurse that doe along until 7 days before the due date, then you can give it an injection probably of dexamethasone, which is a corticosteroid, and that will induce the kidding in the next around about 53 hours. The corticosteroids are better than prostaglandin unless it's very close to the due date, because they help the kids' lungs mature. But if they're within 144 days, you can use both or either. And you're looking between 30 to 72 hours for those to work. But again, a vet's needed to give those injections. Prostaglandins are quite serious if you accidentally inject yourself. So how to prevent it? You prevent it by good nutrition, not letting your goats get obese or too skinny before mating. Consider energy first, then protein, and only then do you look at vitamins and minerals. Unfortunately, many hobby farm mixes are very, very low in crude protein. This one here is only 10% crude protein, and that's not enough for maintenance, let alone a pregnant goat. So pregnant does in late pregnancy need a nutrient-dense feed that's high in energy and protein and is very easily digestible. So they need access to good quality fodder, so good quality hay or grazing crops such as green oats in the last month. Pregnant and milking dairy goats will need to be able to pick and choose mouthfuls of fodder, and they'll need some concentrates as well in most situations. You need to allow goats to waste up to 10% of their feed so that they're only eating the very best quality of that hay that you're providing, and just pick up and feed those leftovers to another species such as a horse or a cow, or use them in the garden. Don't force them, if they're in late pregnancy, to eat all the stalks. So this is from the table. There are nutritional tables available, so you can work out exactly how much pregnant doe needs. So I've taken a 30 kilogram non-dairy goat. So this is a pygmy, for example, or a miniature goat. If she's got triplets, what I want you to see here, this is maintenance. So this is just normal, not pregnant. Early gestation, slight increase. But look what happens in late gestation. The dry matter intake actually goes down. And that means that the energy concentration has got to dramatically increase of the food that she's eating, because the dry matter intake as a percentage has gone down and as a total has gone down. The calcium needed per day increases rapidly in gestation, and the protein, especially in that last month, really increases a lot. So let's now have a look at a 60 kilogram dairy goat. Again, the energy concentration has got to increase dramatically, because it's a slight increase in dry matter intake, but not near enough to allow them to get all the requirements they need. You'll notice the calcium has gone up and the protein has gone up as well. And once they're milking, if they're milking a lot, then again, the requirements dramatically increase. Vitamin A requirements also increase. So late gestation, 3 kids, this is your vitamin A requirement. So there, not quite double. And here, non-dairy goat, again, not quite double, but significant increase. But the good news is you can meet that whole daily requirement if you just give them 1 or 2 cups of carrot slices. So buy a bag of stock carrots and just make sure you feed them to them. This is some common feeds. So lucerne hay, high in energy, high in crude protein, high in calcium, high in vitamin A. So an excellent feed for a pregnant goat. Barley hay, again, not as good for protein, much lower for calcium and vitamin A. Now, grain has almost no calcium and almost no vitamin A. Barley, but it is high in energy, and that can be quite useful. Soybean meal, again, high in energy, very, very high in crude protein, not so good with calcium, and virtually no vitamin A. Vitamin A and vitamin E are critical. Vitamin A goes into the colostrum and it provides the kid with needed vitamin A. However, goats can store vitamin A and E in the liver. After about 6 months of no green feed, however, that store of vitamin A is gone. So if you're a hobby farm, then you can just feed some carrots to meet those requirements. The other thing to do is to make sure that worms are not taking the doe's nutrition. So you should all know how to do a Fermatcha score if you've got barber's pole worms, and most goat farms in Victoria would. Do some fecal egg counts as well. Now, goats, when they're heavily pregnant, there will be a rise in their worm egg count. So if you're going to move them to a prepared kidding paddock, might be some grazing oats, or it might be a small yard close to the house so you can protect them from wild dogs, then you might need to drench them, but do so gently. If you've only got a few, then you should drench them after kidding, or you should be feeding them biowormer. At least you should be monitoring their worm egg counts to make sure you know what the situation is and how many worm eggs are being excreted, and therefore how many worms are taking the doe's nutrition. The other thing I wanted to mention in does and late pregnancy are prolapses. So here we can see a prolapsed cervix and vagina, and here we actually have a prolapsed rectum, which is more unusual. And basically, there's so many kids inside that abdomen, they're pushing their insides out. They're pushing their cervix out. That is a fault. They should have strong muscles, strong ligaments to keep that cervix inside, but in some does, it's weak. Now, if the prolapse, like this one here, goes back in when the doe stands, then just keep her in a clean environment. When those ligaments relax, and I'll show you the ligaments I'm talking about soon, that prolapse will disappear and she should kid normally. However, don't mate that doe again. Either colour or just don't mate her. Keep her as a pet. That's because once she's prolapsed once, she's more likely to prolapse again. Doesn't happen all the time. So, for example, if she prolapsed and she's got 3 kids inside, if the next time she gets pregnant she's only got 1 kid, she mightn't prolapse. But the probability is that she will prolapse and it will be even worse. So don't mate her again. The other thing to look at is subclovers. Some subclovers, and these are the types of subclovers, and you'll get this with the slides, are high in estrogen, and that makes does and ewes more prone to prolapses as well as causing infertility. So check what species of subclover you have if you do have subclover. So let's talk about how to tell the difference between vaginal prolapses and uterine prolapse. Vaginal prolapses are very common. Uterine prolapses are rare. Vaginal prolapses is much smaller in size compared with uterine prolapse. It is smooth to slightly wrinkled in contour, whereas your uterine prolapse has got all these little like slices of salami all over it. Vaginal prolapse happens before birth because you've got the kids pushing out that cervix. Uterine prolapse only happens after kidding and for no known reason. Vaginal prolapse is genetic, so cull or don't mate. Uterine prolapse is just bad luck. Vaginal prolapse, make an appointment with your vet, but it's not critical. Uterine prolapse is an emergency, but you can't transport them, so you have to get the vet out. In the meantime, get a clean sheet, sort of wrap it around it, keep the dough still. You can put some sugar on it to try and reduce it in size and just keep it as clean as possible. So kidding, how do you know how close she is? You should check the ligaments. And on this white goat here, you can see how I've drawn in pen those ligaments. And you can feel one side of the vertebrae on the hip area there and to the base of the tail. You can actually touch your thumb and finger all the way down. The udder will fill, but sometimes that's a bit late. It might only happen just 6 hours beforehand. The belly will drop. So you can see here with this doe, the belly's dropped. So she no longer looks like a walking tabletop and it's sunken down there. And there's some mucus. Now, a little bit of mucus is normal and just ignore it, but a large amount of mucus is a good sign. So here we've got a doe, the owner's being able to touch the thumb and fingers all the way down, and there's this large amount of mucus. First stage of labour, they obviously are uncomfortable. They start to dig holes. They talk to their kids, so they're more vocal than normal, much more affectionate. The cervix dilates and the kid moves into the pelvis. And that first stage of labour, which is 3 to 12 hours, 12 hours more in your first kidders, and that ends when the mucus plug comes out. The second stage of labour is kidding, when you can see the sac, legs, and hopefully a nose coming. And the third stage is just the passing of the placenta. And you can see here the lumps that therefore that's a placenta. So when do you get assistance? Either from yourself or from an experienced goat breeder or a veterinarian. Now, you should always get assistance if you see this bright, dirty yellow colour, either in the mucus or in a kid that's starting to come out. So that's one reason to check or get a veterinarian. Then there's the 30-minute rule. 30 minutes of straining, you should see the fecal sac, though this can be a little bit longer in first kidders. Another 30 minutes, you should see the kid's feet and hopefully the nose on top of their feet as well. The next 30 minutes, the first kid should be out, and another 30 minutes, any second kid. That's very variable. Sometimes it only takes a few minutes, but sometimes they're busy cleaning up the first kid and then they get serious and will pop out the second kid. So just again, this meconium staining is a sign of fecal distress. So if you see mucus of this colour, you need to do some investigation. The meconium is what's inside the gut of the fetus. So the fetus's gut is always shedding the lining, making new lining, and this accumulates in the gut, and it's the black tar-like feces that comes out in that first bowel movement of a newborn kid. Now, if the kid is squashed while trying to get born, then some of that meconium comes out of the rectum and it stains the amniotic fluid, and so it stains the mucus and it stains the kid. So if you're going to insert a hand into the doe's vagina, you need to wash your hands and arms and the doe's perineum. Trim your fingernails. No vets have long fingernails. Remove any jewellery. Glove up. You need long AI gloves. You can add a short glove over the top. Disinfect and lubricate that glove and be very gentle. The uterine wall of a doe is very easily torn. Now, I just checking the time, and I think, yes, I've got time to show this. So this is kidding with some assistance. It's on my YouTube channel, Goat Vetoz. So you can see she's dug herself a little hole. middle of the night, so I've got a headlamp on. So 2 front legs, that's the diving position or the Superman position. So I'm just feeling, making sure there's a head there. Pulling down towards the hock at 45 degrees. Dealing with the contractions. So wiping it to stimulate respiration, trying to clean it up, dry it off. You don't want it to get chilled. Putting it on some nice clean hay for the mother to eat.
The kid 45-degree angle or towards the hock, and I pulled it when they contracted, and also I kept one leg in front of the other. Now the kid's with the mother, and it's had its cord dipped in 7% iodine, which is a critical step to prevent joint ill later in the kid's life.
Okay, so this is some of the equipment you might like to get. Obviously, AI gloves. Sometimes I like to put on a little short glove over the top of the AI glove, just because those AI gloves are very sort of roomy. You can't really feel a lot through them, but if you put a little wrist length glove over the top of it, it's much better. A lambing tool is very useful, very cheap to buy, and some quality disinfectant. So Hibitane, Hibiclens, any of those would be useful. You need some ropes, and most importantly, you need a lot of lubrication. So, and remember that lubrication, you can either buy 5 litres of lubricant from your vet, or you can use KY jelly. So just KY jelly from a chemist. But you've got to get that behind the stuck kid. So you'll need a large syringe with a bit of plastic tubing on the end, and you can poke that behind the kid's head to get the lubrication behind the kid. There's no good in lubricating the part of the kid that's already out. You want to lubricate the bits that are stuck. So you can use human lubricant, vaginal lubricant, or obstetrical lubricant, but make sure you've got plenty. You need some ropes. So this is from a lambing manual that you can use leg ropes there. When you put the ropes on, you have to put them slightly above in the long bones. There are knots, and you can read that and make the knots. So don't put them below the dew claws, because you can dislocate that joint. It's got to be up in this long bone here. So that's where you put the ropes. It's very handy, for example, if you've got 2 legs. Excuse me. If you've got 2 legs and no head, you've got to push those legs back and grab the head. So before you push them back, tie a rope on those legs so you can get them again. if the kid's coming bum first, and you can tell because you put your hand in and all you can feel is a tail and an anus, you've got to get those hind legs out, but cut the hooves in your palms so that you protect the wall of the uterus from those hind legs. Then pull the hind legs out, whereas before, when it was in that Superman or diving position, I was pulling 45 degrees down towards the hock. But when the hind leg's there, you twist the goat's legs slightly off centre, just slightly off the vertical, and you pull directly back. And you need to be quick because the head's in the uterine fluid and the umbilicus is getting pressed, so that kid's brain is not getting any oxygen. If you're using a lambing tool on the head, you've got to put that through the mouth. Don't put it so it's strangling the kid by putting it underneath the head. It's got to go at the back of the ears and then out through the mouth. Now, I don't have time to show you this, but it is on my YouTube channel, and that's where I go through all the kidding positions, and you can look at that at your leisure, and I explain what to do with the various positions. The causes of dystocia, which is the scientific name for difficult kiddings, some of the problems are the does, and therefore you might think about not mating that doe again. So if the cervix fails to dilate or there's a prolapse, the cervix failing to dilate, that's a reason to call the vet. The vet can use drugs that's going to help that cervix dilate. If there's uterine inertia, so the uterus muscles are not contracting properly, it's probably subclinical milk fever or hypercalcemia. The kid doesn't fit through the doe's pelvis, so the doe's pelvis might be too small, so don't mate her again. Uterine prolapse after kidding, that's the doe's issue, not the kid's issue, but it's unlikely to happen again, it's just bad luck. And inguinal hernias can happen in pregnant does, and that's the doe's problem, so don't mate it again. If it's due to the kid, it's probably just bad luck. So 2 kids coming at once, or they've got the head back, or they're coming bum first, that's just bad luck. A single large male kid, they're always difficult, and you may have to help those. If the kid is dead inside due to some disease, then that's the kid's fault. There may be a congenital defect. So beta manicidiosis, again, there's a video of that on my YouTube. And with that, the front legs are bent. And if the front legs are bent, it's very difficult for that doe to have a normal kidding. Akibani virus, which is a problem in Queensland and New South Wales, but with climate change, it might get down to Victoria. That, again, causes problems with that seizing of the legs and not being able to straighten those legs, and fetal monsters, which are very rare. So if you think you've got uterine inertia, what can you do? In America, they're always talking about feeding Tums. The equivalent in Australia is Quickies, and that's calcium carbonate, but you're going to have to give an awful lot. We don't have those oral preparations of calcium which are available elsewhere, but we do have the veterinary medicines that treat milk fever or hypercalcemia in dairy cows, where it's very common. So you can use, this one here is just calcium boraglutamate. This one here is calcium magnesium phosphate. You can use either. The dose, obviously you don't use a full pack. It's 80 to 100 mils for dairy goats, 50 to about 50 mils for miniatures. And it's best done by a veterinarian because they can give it intravenously because you don't have much time. And if it's given intravenously, a vet needs to monitor the heart because it will affect the heart muscle as well as the uterine muscle. But If you can't get a vet, then you can give it subcutaneously. Now, if you've got a good relationship with your vet and the vet knows you're experienced and you're going to call them again the next day if you assist in kidding, they might provide you with some foaming pessaries, because if you go in to the uterus to sort out a kid, then it's a good idea to give an antibiotic pessary. Does that have to be helped at kidding will need pain relief. So that could be bucalgesic, ketoprofen, Flumax, lots of different possibilities, and they may need antibiotics, especially if the placenta is retained. We don't try and remove it anymore. We just make sure that there's no infection. Now, neonatal kits, if the kid is not breathing, what do? You never hang it upside down. You never swing a kit. You never give it mouth to mouth. That's a sure way of getting Q fever or other zoonotic diseases. You rub it with a towel. You can tickle the nose with a straw. You can use one of these, which is a turkey baster, or sometimes they're sold for removing snot in babies to get any fluid or mucus from the mouth and nose of that kid. And there's also an acupuncture point. This is the acupuncture point. So you're using a very tiny 25 gauge needle in the nasal philtrum, and you're rotating that clockwise. That might be worth trying. It's used in a wide variety of species. So for newborn kids, remember 1, 2, 3. The kids must stand within 1 hour. They must get colostrum within 2 hours. Ideally, you could go up to 4 hours, but 2 hours. And they should produce that black tar-like meconium within 3 hours. So that's the 1, 2, 3 you remember for newborn kids. Panting in newborn kids, if there's been a difficult kidding, then there's a high level of carbon dioxide in the blood of these kids, and so they get rid of that by panting. So that's how they get rid of it. In the first 12 hours, 24 hours, don't worry too much about that. It's not a pneumonia. It's just trying to even out the blood carbon dioxide levels. So once the kidding's over, feed the doe, as we saw in that video. Give it some warm water and molasses, appreciate that, and have a warm box or a retreat for that kid. That can be as simple as a cardboard box on its side with a bit of bedding straw in it. So the kids can be away and keep warm in that little area, and put some feed on top of it for the mother to eat. The other thing you need to do is clip, dip, and sip. So you need to clip or cut the navel cord so it doesn't drag on the ground. If you wish, you can tie that off with dental floss. You need to dip it in betadine or something similar. And the reason being that the navel cord has 3 tubes in it. One tube goes directly to the liver and into the arterial bloodstream. One tube goes back to the vena cava, the main vein in the body of the goat, from the abdomen going straight to the heart. And there's also a tube going to the bladder. So they're all points where the bacteria can get straight into the bloodstream and cause severe illness. Now, kids, colostrum is essential, but that colostrum must be disease-free. So you don't want to pass on Johne's disease or caprine arthritis and encephalitis, because that's passed in the colostrum. Research has shown that goats naturally should have colostrum from their mothers, assuming they're disease-free. Artificial colostrum at a low dose rate only provided protection from 2 out of 7 kids. Artificial colostrum at a very high dose provided protection for 4 out of 7 kids. Be careful if you're using cow's colostrum. It's free of CAE. but it may not be free of Johne's disease. So kids need about 10 to 15% of their body weight in milk every 24 hours in as many feeds as you can make. So if they're very tiny kids, that might be 6 feeds. If they can take a bottle, then a Pritchard teat is useful. But if they can't, then you're going to have to stomach tube them. So you can get your vet to show you how to stomach tube. It's a simple technique and you should learn how to do it. You can buy these stomach tubes. If you don't have one, a chemist may be able to provide you with a human urinary catheter. Now, if you find a cold, flat kid out in the paddock, don't warm it up. If it's more than 5 hours since it was born, then you need to give intraperitoneal glucose first before you warm it up and before you give it some warm colostrum. We don't have time to look at this, but there's a YouTube video there that goes directly, shows you step by step how to do this. But basically, you're putting in a needle into the abdomen, aiming it towards the back hip of the opposite side, and you're injecting the glucose. Now, Victoria, unfortunately, has large areas of mineral deficiencies. So you've got a good selection there: cobalt, copper, selenium, and iodine deficiencies. Now, all mineral needs are local and they're very complex. For example, if you've got high iron levels in your water, if you've got bore water with high iron, you can see that high iron level is going to interfere with the absorption of a whole range of different minerals, including copper. So ask your local vet, they'll know what minerals are deficient in your area. Now, tests are available, but there's different tests for different minerals, so you can't just use the same test and test for everything. And you'll notice that there is no blood test for iodine, but you can check thyroid hormones. Selenium, there is a blood test. Cobalt, you can test for vitamin B12 because goats use cobalt so that their rumen bacteria can make vitamin B12. And copper, again, there is a blood test that can be used. You'll notice there's no hair tests there. I'll just point that out. So let's have a look at what you might see. So with selenium deficiency, you'll get white muscle disease. Now, this here kid, I don't think is white muscle disease. I just think those legs were bent up in the uterus. Now, sorry about that. This is a huge goiter. You wouldn't see normally such a large goiter. But I did want to show it because I wanted to show the lack of hair in this kid. This here is a normal thyroid gland. Very difficult, very little to see. Here's a case report of Angora kids that died after an embryo transfer program and the mothers were deficient. Tiny kids, high thyroid weights, and very little hair. So these kids actually die of coal stress. So again, you don't really see goiter unless you dissect them out, and then you can weigh them. So this is the normal values of the thyroid gland, and this is the goiter values. So markedly increased in weight, but also length, width, and height. And if you compare the grams per kilogram of kid, then you got a ratio you can look at. Trace minerals for pregnant does, you can give them by boluses. Copper oxide wire particle boluses are the only safe way give copper. You can use worm drenches. A lot of them have added selenium. Here's another bolus, and you can use mineral licks. But make sure the mineral licks are protected from the environment, and the goats actually use them. If you can use, you're putting out loose minerals or mineral licks, weigh them. Make sure that the goats are actually using them. Now, goats only will be attracted to salt and phosphorus. They're not attracted to any trace minerals. So this view that goats know what they're deficient in and will go and seek it out is totally wrong. And that's a reference to prove it. Now remove any pure salt licks. Goats love these salt licks. As you can see here, they're really getting stuck into it. But salt is what attracts them to lick their mineral licks. So if you're providing pure salt, they're not going to go and lick their mineral licks or eat their loose minerals. So you must make sure you remove any of these salt licks. Whenever I see them, I tell the owners, get rid of them. Now, vitamins, they only need vitamin supplements if they've been off green feed for more than 6 months. Remember that vitamins A and E are stored in the liver. Now, this is my blog, and I've written an article about how you must have a veterinarian that knows you, knows your goats, knows your farm. Call them out before the kidding season. Ask them to write your prescriptions. You do need prescriptions, even in Victoria, where it's legally allowed to use sheep worm drenches on goats. However, because you need to use the sheep worm drenches at higher dose rates than on the label of the goats, then you need that prescription. So get them out, then talk to them about prescriptions and also about emergency services for kidding. And that's the end. Open to questions.
Thanks for that, Sandra. A lot of useful information in there. So yeah, if you've got any questions, please put them in the Q&A section. We'll try to get to them all. So we've got a few there already. First question, can you explain what the corpus luteum is, please?
Okay, so when the corpus luteum literally means yellow body, and it's on the top of the ovary. So when the follicle is released, so the egg is released, that whole becomes the corpus luteum, and that produces progesterone. Now, if the egg that came out of that follicle is fertilized, that corpus luteum stays there, and that produces progesterone. So basically, it's a little knob on the top of the ovary producing hormones, the pregnancy hormone.
Yeah, great, thank you. This question is about kidding. If you need to tie ropes when you push back in, if the head is back, do you tie each leg or tie the legs together?
Tie each leg. And actually, I was watching a few videos from America, and someone recommended these conference lanyards as suitable for tying the legs. I've used flat boot laces because they're nice and soft, and they're wide, so they can use it. So yeah, I put that out. I'm going to put it in my kidding kit. So yeah, but a separate rope for each leg.
Okay. And does feeding the doe before kidding increase the size of the kids and possibly lead to dystocia from oversized kids?
I don't think so. The doe and the kid pregnancy theme if you're trying to feed.
Is FlowPack Plus the same product as Minbel that I use for cows that have 3-day fever?
I'll just go back to my slide. Probably is, but I'll just. I just can't find it now. Here we are. Double cal. Yeah, those if they're registered for milk fever, then that'd be suitable. And a lot of dairy farmers would actually use them, I think, for 3-day sickness as a pick-me-up. So that's double cal, not min cal. So I'm not sure about that product.
Okay.
But there's a large number of brand names. I looked it up a day or so ago, and there was about, I don't know, 8 or 10.
Next question. Can you explain milk gore? Is it of concern?
Milk what?
Gore?
Gore?
Yes.
I've never heard of it. Sorry.
Sure. Maybe clarify that one. Can you see pregnancy toxemia in early pregnancy or just late term?
Just late, so it wouldn't be before the last 6 weeks. Now, you can get a similar condition, which is ketosis, which occurs after kidding in very high milk producers. It's treated the same with ceton or similar, but you wouldn't see it in early pregnancy because of there's not that nutritional drain on them.
Is there a higher risk of toxemia with diseases like JD or CAE?
Yes, I think so. Yep.
Great. Just with that previous question, explain milk goiter. It was meant to be.
Oh, goiter. Okay, I can understand milk goiter.
Typo.
Now, milk goiter is actually not goiter. Goiter is enlargement of the thyroid gland. Milk goiter only happens in very, very well-grown kids, about 6 to 8 weeks of age. They're getting plenty of milk, mainly male kids, and they have a very enlarged area underneath, around their larynx, but also in front of their chest. And I actually did my PhD looking at the neck of the goat and dissected lots of necks. I can tell you that's just the thymus gland. So that's normal. I like to see it. It means you've got a very, very well-grown goat and you're providing excellent nutrition. But it's not goiter. It's actually enlarged thymus gland.
What time frame is it best to cut and dip the umbilical cord?
Soon as possible. Okay, so with that kid that I helped deliver, towelled it off and would have dipped it straight away. And
Yep.
I recommend that people have a little container of iodine, and every time they pick that kid up in the first 12 hours, they dip that cord again.
And how
Make
short
sure
should
that
you,
it's
how short should you trim that cord?
about that much. You don't want it, you do want a little bit there, but you don't want it dragging on the ground.
Is it true that potassium deficiency can cause dystocia?
Never heard that one, sorry. Calcium deficiency, yeah, but not potassium.
Okay. Do I still need to provide copper if I'm providing Olsen's goat block?
I think it's got some copper in it, but a lot of the mineral licks, and I'm not sure about Olsen's goat block, I haven't read the ingredients, but a lot of them put just enough copper in it so they can put copper on the label, but it's not enough to actually be good enough to treat a copper deficiency or prevent copper deficiency. So Olsen's actually make a copper cobalt block. And if you're in a copper deficient area, you should be using the Olsen's copper cobalt block rather than the normal one, because it's got much more copper in it. And a lot of those mineral links just have enough copper so they can put it on the label to make people think that that's a good buy. But again, be advised by your local vet. They'll know what deficiencies are in the area and how best to treat them.
Around nutrition, is prime lucerne beneficial to feed to does after kidding to support lactation?
Yes, very much so. So if we go back to that, nutrient requirement, you'll see that after kidding and that milking, if they're milking a lot, then they have a very high need for protein, calcium, and energy. And if you look at lucerne, prime lucerne, it's high in energy, it's high in protein, high in calcium. So it's an excellent feed for your milking goat.
Can obese fat does go on a diet of just oat and hay and minerals to reduce weight?
Yes. And encouraging exercise. Take them for a walk, take them out browsing.
Is sainfoin, sainfoin, a suitable forage for pregnant does?
Yes. And it's also got some parasite protection values as well.
Is it true putting a bit of copper pipe in their water container will help with copper deficiency?
I've heard that on the internet, but I've seen no scientific evidence to support that.
Okay. And if you do egg counts before kidding, how many weeks before do you recommend? And at what egg count would you drench?
Okay, it depends if you got Barber's pole worms or not, and also if you're feeding bioworm or not. So it varies a bit. Now, if you're in a Barber's pole area not feeding biowormer, then my cutoff point for a doe in late pregnancy, early lactation would be 500 eggs per gram. If it's a dry goat, it's 750. If they're on biowormer, I'm trying to get a university to look at this because I'm seeing a lot of really healthy looking, sleek, nice red Fermacher scores, but they've got a high egg count. I just can't figure it out because they look so healthy. And so another vet and I are thinking that the egg count level, if they're on biowormer, the cut off for drenching should be about 1,000 because you're not going to get this rapid rise. So it varies.
Okay. Will does overeat if given premium lucerne hay, causing bloat?
No, bloat's very rare in goats. So, and we're talking hay. I've not seen a goat ever bloat on hay. Maybe lush pastures, but yeah, look, it's extremely rare. Goats and sheep don't really bloat like cattle do.
And what should you do if a kid isn't able to stand within 1 hour?
Okay, so my recommendation would be you would put it in a box with some straw, because you don't want it trying to walk if its legs are wonky. You want to just encourage it to stand still, keep it warm, feed it, and just nurse it along, so that those legs will eventually get stronger in the next couple of days. But don't let it struggle. Don't let it try and follow its mother. Make sure it's getting fed, bottle feed it, because it's not going to be able to stand and get up to the udder. So just put it in a box with nice warm straw. The mother can still look at it, still lick it, and you can even take it out and hold it up to the udder if you want to raise it, and just let those ligaments and muscles get stronger, so it can walk. And generally they improve in the next, two days or so.
Thank you. And can you feed biowormer every second day?
I haven't seen any research. Obviously, the recommendation of the manufacturers to feed it every day. So I can only go by the research that was used to register it and the recommendation that's on the label. I believe there is some research being done in America, but I haven't seen that published yet. There has been one publication about adding biowormer to the mineral lick for those people that don't feed every day. But in a hobby farm situation, I'd be feeding it every day.
Yeah. And are the ligaments of kids affected by the same hormones that loosen the ligaments of does to help them deliver?
It's an interesting theory. I hadn't thought about that. Yeah, possibly,
I'll have to get back to you on that one.
Yeah, that might involve some research. There's none to date. But yeah, that's an interesting theory. I think it's more likely that they've just been squashed because you see it more often in multiple kids. So they've just been squashed in the uterus.
Can you feed a kid after 48 hours some full cow's milk as a top up while still drinking off mum if you think they're not getting enough, or should you just use mum's milk?
No, you can use full cow's milk. Just make sure that it's pasteurized, full cream. For hobby farmers, they don't want to buy a big 25-kilogram bag of calf milk replacer or milk replacer, because that's, they're never going to use it up. It's going to expire. So there's nothing wrong with going to Woolworths and buying a big pack of full cream powdered milk and mixing that up and using that. Or some people use UHT milk. And I'd prefer that than going to your neighbouring dairy farmer, especially in Victoria, where there's high incidence of dairy farms with Johne's disease. So, yes, full cream powdered milk would be fine.
Okay, that's interesting.
And the other thing I don't like about the milk replacers is you buy them in produce merchants. And produce merchants are generally tin sheds, and they can get very, very hot. And that can denature some of the proteins in the milk replacers, which is why I prefer to use Woolies or Coles full cream powdered milk, because the supply chain was always keeping that cool.
Right. this is more a comment, but on the subject of prescriptions for goats, I had an egg count done by my vet and it was very high. They told me to give Q-Drench at 1.5 times the sheep dosage, but there was no mention of a prescription at all. So I guess that just comes down to working with your vets and educating them, as we spoke
And
about.
and you know, you probably be right until the day you get notified you're having a livestock production assurance auditor coming next week.
Yes, that's right.
And I've had to drive 2.5 hours to go and visit a goat property to write some prescriptions because the auditor was due next week, and the local vet wouldn't write the prescriptions.
Yes. Next question. Do we have a product like Bovicera, which is available in the US and can be given to kids that have an inadequate colostrum intake to help boost their immune system here in Australia?
No, I haven't heard of that one. I'm sorry. I can search for it. That you can go to apvma.gov.au, and if you put in the name of either the veterinary drug or the brand name, you'll see if it's registered in Australia, but I haven't seen it.
Thank you. That's the last question. So
Excellent.
we will wrap it up there. One last one. We've given 3 times the sheep dose of drench for our goats. The question before said 1.5 times. What is right?
Well, it depends on the drench. So for the white drenches, it's the textbook. This says that you're using double the white drench dose rate. And if it's got levamisole in it, then it's only 1.5 times. And Q-Drench has levamisole in it, and the toxic dose is quite low. So you wouldn't want to give 3 times the dose if the worm drench has levamisole. So 1.5 times if it's got levamisole in it. Some of the new drenches, some people say 1.5, some say double. And the textbook that has actually put the dose rate in for monopantal actually says between 1.5 and 2. So they had it both ways. But none of them say 3.
Okay.
And I'm happy to email your vet that page from the textbook, because I email vets that page all the time.
Yeah. Okay. All right. Well, we'll wrap it up there. Thank you, Sandra. As I mentioned, I'll be emailing out the link to the recording and the slides in the next couple of days, so you will get those. And please just fill out the survey, take a couple of minutes just after the webinar concludes. That'd be great and really help us out. So have a good night, everyone, and hopefully see you in another event in the future. Thank you.
Okay. Night, everyone.
Bye.